Narcissistic Personality Disorder, NPD. And no, this is not just someone who likes compliments or posts too many photos. The real thing is a completely different level. People with NPD have a grandiose belief in their own importance, an obsessive need for admiration, and very little genuine empathy for others. They genuinely believe rules that apply to everyone else do not apply to them. What most people miss is that underneath all that confidence is an incredibly fragile ego. Criticism, even small, casual criticism, can send a narcissist into what is called narcissistic rage. They are also famous for love bombing, flooding a new person with affection and attention early on. It feels overwhelming in a good way, until the mask slips, and it always slips. Psychopathy. Not a serial killer. That is a movie thing. Most psychopaths look completely normal. The core of psychopathy is this: they do not feel fear or guilt the way you do. Emotions are just quiet. So they learn to fake it. They watch how normal people react and copy it. In social settings, they can be the most charming person in the room. What makes this dangerous is they can use people without feeling any weight about it afterward. Zero guilt, zero remorse. Primary psychopaths are calculated and cold. Secondary psychopaths are more impulsive and volatile. Both are very good at wearing a mask. Machiavellianism. Named after a guy who literally wrote a guide on how to gain power through manipulation in the 1500s. A Machiavellian person is cold, patient, and strategic. They are not impulsive. They plan. They will build trust over months, just to cash it in at exactly the right moment. In a workplace, they are the person who seems the most helpful and loyal, right up until they throw you under the bus. They also believe everyone else is just as manipulative as they are, just worse at it. Antisocial Personality Disorder, ASPD. This is the clinical diagnosis that sits closest to psychopathy, and they overlap a lot. People with ASPD consistently violate other people's rights, lying, manipulating, breaking rules, with little to no remorse. Here is the part that surprises people. Most of them look totally fine on the outside. Jobs, families, social lives. The damage they cause is mostly invisible, emotional, financial. Schizophrenia, most stigmatized disorder on this list, and also the most misrepresented by movies and TV. First, this is not multiple personalities. That is a totally different condition. Let us be clear about that right now. Schizophrenia is a psychotic disorder that changes how someone perceives reality. Positive symptoms are things added to experience that should not be there, like hearing voices, clear, real-sounding voices. Negative symptoms are things taken away, flat emotion, withdrawal, loss of pleasure. These are actually harder to treat. Bipolar disorder, not just having mood swings, not just a rough week. We are talking about full episodes. During a manic episode, someone might feel euphoric, sleep almost nothing, spend thousands of dollars on impulse, make huge life decisions with zero hesitation. It feels incredible from the inside. It often destroys things from the outside. Then comes the crash, weeks or months of deep depression. Not just sadness, complete shutdown. Both types are serious. Both are very treatable. PTSD, post-traumatic stress disorder. Most people think soldiers, but it can happen after any overwhelming or life-threatening event. What happens is the brain gets stuck. The traumatic memory does not get filed away like normal memories do, so it keeps coming back. Flashbacks, nightmares, sudden overwhelming feelings like it is happening right now. The nervous system stays stuck in alert mode, always scanning for danger, overreacting to small things. The good news, EMDR therapy has one of the strongest track records of actually resolving it. OCD, obsessive-compulsive disorder. And before anything else, liking a clean desk is not OCD. Let us put that to rest. Real OCD is a loop. An intrusive, unwanted thought causes intense anxiety, and the only way to relieve it is to do a compulsion. Check the lock, Wash your hands. Count to a specific number. It works. For about 10 seconds. Then the thought comes back louder.